maternal and child health is very important, and this is something that we have to look into it, and we have to work for it. And next slide, please. Why we think that mother and child health is important? Because the child health is closely related to the mother's health. And during pregnancy, if we are looking after the mother and giving proper care to the mother, we ensure that the baby is going to be healthy. There are not going to be any problems with the mother and child. And of course, they are the future. I mean, with the healthy mother, the future is going to be healthy. Next slide, please. Okay, so if we look at the spectrum of health, we are talking about the mother's health, mother and child health. We find that there are two extremes in this spectrum. One is the best of health or the positive health, and the other extreme is death. In between, there are various fluctuations that goes on. Sometimes the mother is sick, and sometimes she is fine. And if we want to look at the health of the mother, we obviously we would look for the other extreme, that is the death. That is one indicator which tells about the status of the maternal health in a particular region or a country or globally. So we talk about the indicator for mother's health is the maternal mortality. We call it maternal mortality rate. Next slide. Okay, so this map shows the status of maternal mortality all over the world, and you find this that most of the countries they are showing very low maternal mortality, that is less than 100 maternal deaths per lakh live births. But in India, this is somewhere between 100 to 299, and some of the countries it is showing extremely high maternal mortality. So there's a lot of variation all over the world as far as the maternal health is concerned. Next slide, please. Now, pregnancy, as you all know, that right from the beginning, there is plenty of time that we can deal with some of the complications and we can avoid those complications. And the common complications or the common problems we find during pregnancy, or we call it high risk pregnancy, is the most common is anemia. That is, the hemoglobin levels are less, and physiologically during pregnancy the hemoglobin levels tend to fall. And in India, this is the most common problem, and this is the most common reason behind maternal mortality. More than 80% of mothers, they are suffering from anemia. So if we find early in the pregnancy that the mother is anemic, we can very well give iron supplementation to the mother and avoid the complications. The other high-risk pregnancies are elderly pregnancy, when the woman is becoming pregnant for the first time at a higher age, or when the height is less than 140 centimeter, or even when the weight is less than 45 kg, and when there is a history of threatened abortion or a history of antepartum hemorrhage, that is the hemorrhage or the bleeding during pregnancy, or very common these days, multiple pregnancies or twin pregnancy, or there is a history of previous stillbirth, or the baby died in the uterus, or the female has given birth multiple times and is in higher age category, or the pregnancy is prolonged. This is after 40 weeks of pregnancy, or there is a history of previous cesarean section, or the pregnancy is associated with medical disorders, and so many medical disorders are very common these days, like hypertension, diabetes, hypothyroidism, and there are other medical disorders. Then there is a history of consecutive spontaneous abortions, and if the female has taken treatment for infertility. So these are some of the conditions we can very well anticipate, and we can avert the complications by identifying these as high risk pregnancy. Now, if we look at the causes of maternal mortality, the most common cause is hemorrhage. Hemorrhage is bleeding. So this bleeding could be even during pregnancy, we call it antepartum hemorrhage, or this could be during the delivery, or after that we call it postpartum hemorrhage. And the most common reason for postpartum hemorrhage is anemia again. So you see, all these conditions are interconnected to each other. Then there could be even sepsis or the infection, because of so many medical reasons behind that. Then there could be other conditions like which get aggravated while the female is pregnant, like hypertension or diabetes. So these are the common problems which are leading to a high maternal mortality, and you can see that all of these are preventable. So that is these slides, you could see that maternal mortality is more than 100 in so many countries. So, I mean, this is something we can work upon. Next slide, please. And when we look into the causes of infant mortality or the neonatal mortality in India or some otherwise also, we find that the most common cause of the early death of a newborn is prematurity, when the baby is born before the time or before 37 weeks of pregnancy, or the baby is born with a very tiny or very low birth weight, and the ideal birth weight should be 2.5 kg and more. But if it is less than that, then the baby fails to survive, or when the baby is premature. So again, this is connected to the mother health. So if the mother's health is poor or the nutrition is poor, then there is every possibility that babies will be born premature or a low birth weight. Similarly, if the baby is suffering from any congenital anomaly or some infection is there, these are common causes. And when we look at the spectrum of infancy, we find that infancy is from the birth till 1 year of age. So we find that most of the deaths, they are occurring in early 28 days of the life, and in these 28 days, the first 24 hours followed by 48 hours and followed by 7 days are most crucial when most of the deaths are occurring. So you see, the common reasons for these early deaths is prematurity or congenital anomaly. But as the baby survives for few days, then the chances of getting infection increases. So the infectious diseases like diarrheal diseases or pneumonia or other problems, they come into action. And of course, like this. Now, as I told you that when we can start this prevention program. So it is not that, please, previous slide, please. Care. So if we look at this continuum of care, we see that it is not that we have to start the preventive care when the female is getting pregnant. We can start it early also, so that the problems like malnutrition can be solved before the female is becoming pregnant. So if we ideally, we should start it from 15 years of age, and once the girl is entering the reproductive phase of life, and this can go on till the child birth and till the child is becoming 1 year or 5 years of age. So this is how we can cover the mother and child over the vulnerable period, and we can provide the care to them and prevent the deaths. Next slide, please. Now, how we can do that? I mean, there are areas of intervention during pregnancy, and as I told you that we get almost 7 to 8 months when we can provide care to the mother, and we can look at various parameters whether the pregnancy is going on normal or there is some problem with it. So what we can do is we can do a lot of a battery of lab tests, like we can look for the hemoglobin, that is to look for anemia. So if the hemoglobin level is less than 11 milligram, that means there is anemia. And we ensure that the female is coming for antenatal checkups regularly to the clinic, and then we are doing these tests like hemoglobin estimation, or look for the blood sugar levels, or whether the urine examination is normal, or there is appearance of sugar or protein in the urine. So all these tests, they let us know whether the pregnancy is going on normal, or there is some problem. We can also look for various infections like HIV and sexually transmitted diseases by simple test, and we can intervene. Similarly, the blood pressure level, it is very important to monitor the blood pressure during pregnancy, because this is one parameter which is going to increase during pregnancy physiologically also. So during every visit, the blood pressure is measured and it is monitored over a period of time. And pregnancy induced hypertension is very common during pregnancy. Then the weight is also going to increase during pregnancy, and the ideal weight gain should be between 10 to 12 kgs. So therefore, with increase, when we are monitoring the weight, we ensure that the baby is growing normally in the uterus and everything is going on fine. Similarly, we can also do the fetal growth monitoring by ultrasound and otherwise also. And these are the common things we are doing during pregnancy to anticipate any complications. Next slide, please. Now, this is something we are providing longitudinally. This care is being provided to the female longitudinally during pregnancy, but emergency can happen anytime. And when we analyze the emergency conditions, we find that the death happens due to three delays. The first delay is deciding to seek appropriate medical help for an obstetric emergency, and this usually happens in far-flung areas where the people are not too aware about these problems which are happening during pregnancy, and they delay the deciding about seeking the appropriate medical help, and the necessary time is lost in that. And if they decide about seeking an appropriate medical help, they fail to get to reach the facility on time, medical facility on time. So this is again an emergency, and the necessary time is lost. And once they reach the facility, they do not get the adequate care. So these are three important delays that need to be looked into once there is an emergency. So therefore, it should be ensured that there is an availability of transport to transport the female who is in emergency to so that she reaches the health facility in time. Then adequate facilities should be available at the health center to deal with that emergency, like whether the cesarean section is to be done or blood transfusion is to be given. So there are so many things to be done. And on top of that, with these facilities, the availability of specialists, the obstetrician, the anesthetist, the pediatrician, all these should be available at the health facility. Next slide, please. So, similarly for child health, again, for preventing the morbidity and mortality during infancy, what we can do is that we can do the regular growth monitoring, whether the child is gaining weight as per normal standards, or the nutrition is fine, the child is being breastfed exclusively during first 6 months, or there is some problem with it. Then providing vaccination to the child in time is also very important, and it is also important for the mother to look for the various danger signs when she can very well anticipate that some problem is going on with the baby. Next slide, please. Now, as I told you that in far-flung areas where there is no doctor and the health facility is also far off, now who is the one who is helping these people? So we have community healthcare workers over there. They are part of that community, and they actually facilitate in reaching out to those people and taking them to the health facility. So they act as a bridge between the hospital, the doctor, and the beneficiary who's the pregnant female or a baby. And another importance of community health workers is they are in regular contact with these beneficiaries. They are giving them advice regarding when the immunization they are supposed to visit the health facility for that. They are supposed to go for institutional delivery or hospital delivery. So this is the role of healthcare workers, and they increase the acceptability of these services amongst the people. So since they are part of that community, so they are actually convincing them to use the hospital services, and that's how the mortality and morbidity can be prevented. Next slide, please. Now, what are the various possibilities where we can work together to reduce the maternal and child health? So, I mean, this is a very good idea that with the data is available in real time for all the stakeholders like doctors and the workers, and this qualified blood pressure monitoring, weight monitoring, hemoglobin monitoring, and they can see the deviation from the normal range, and some intervention can be done. So this is just a possibility that with the use of AI, the automatic messages can be sent to the people that the immunization is due or the antenatal care visit is due, and thus motivating them to go for these services. So we can always give health education also with the AI. So these are the possibilities with it.